Hi, Dr. Dave Webster, and welcome back to my website. This is the case scenario page, as you know. And this particular example or case I'm about to show you is a particularly upsetting case for me from several respects. And because this patient, above all, maybe demonstrates just what this government is prepared to do to say no to patients and not have access to PET scanning. This patient is a patient with breast cancer. And I'll just show you the FDG PET image. This is the one that is in the upper right-hand corner of the home page, but here it is in a movie format where you can see it's in revolving here, and there's a number of things on that picture I'll go through in a moment. But remember that what we've done is we've injected less than a billionth of a gram of radioactive glucose into this patient, and as I've mentioned elsewhere on the website and in my PowerPoint presentation on what is PET, that cancer cells have to use sugar, and so what you're really looking at is a map of many of the findings on this PET scan, as we'll see in a moment, are actually areas of very active cancer in this patient. Anyway, this particular patient was admitted to a teaching hospital, and that hospital on site had a perfectly world-class capable PET scanner. And this patient presented with some terrible problems. There's no question this patient is going to die of their disease. Who knows what PET might have done before if she'd had this at an earlier stage in her treatment and so on. We'll never know. But she's got a serious problem and will die of her disease. But the more acute problem at the moment for her is that she has horrible pain and numbness and weakness and tingling and so on in her face. And the only reason that could be, or it was assumed and was correct, was that there must be a spread of cancer somewhere in the brain or the base of the brain somewhere along the tract of the nerves that were supplying the side of the face there and pinching them, and this was causing this horrible symptoms. This patient had gone through every test that was available to look for these possibilities with CT, MR, bone scanning, things called gallium scanning, and so on. They could not find this abnormality. And what her physicians, of course, realized was that she needed a PET scan. And if she'd have been in Argentina more than a decade ago, they would have known and done that a long time ago in her management. But the bottom line, she lives in Ontario. The government refused to allow her to have a PET scan, at least funded as a PET scan. And what she did do was she discharged from the hospital and she went and paid for her own private PET scan. Let's go back and look at these images again. They're from the PET scanner, and again, this is just instead of a movie now, we're just seeing a single picture. And there's a lot of black spots in there. Some of it is normal, some of it is normal tissues, because all normal tissues also take up sugar. But just looking at this diagram or picture right here, there's a few arrows that I pointed to, and these represent areas of cancer spread to various areas in the body. But more importantly, what we did when we looked at the base of her brain, as you can see in this image here, where there was very clear abnormalities in the base of the brain here, and virtually certainly this is where the tumors were. So she discharged and had to pay for her own PET scan. The government refused to pay for the scan for her. So I spoke to the oncologist, and what they were going to plan to do then at that point was direct some radiation to those areas specifically, in hopes that they could destroy the cancer cells and hopefully give this poor woman some relief from the agonizing symptoms that she was going through and the suffering that she was doing. But what I want you to note is just what this case demonstrates in this province. At this time, they were running the PET breast cancer trials, which, again, I strongly emphasize you look at that site on the website if you've not been to, because that trial was declared blatantly unethical. You'll remember, because the PET steering committee, who purportedly was looking for what are the best possible uses for PET or potential uses for PET, ended up experimenting on 300 women, exposing to unnecessary amounts of radiation when they knew the test absolutely could not pick up the cancers they were looking for in the vast majority of cases. But what they did do is they deliberately excluded women who the entire rest of the world knew could have potentially benefited from a PET scan, and this is that exact patient. This is the kind of patient that would and ultimately did benefit from a PET scan, so she was excluded. So there's a couple of things that are just terribly alarming here. You need to be alarmed, because this is healthcare in Ontario. Was that This patient, first of all, the government refused to pay for a PET scan for her. And secondly, this is the exact kind of patient that would have benefited from a PET scan, but the government deliberately designed a trial through their expert advisory committees that specifically excluded the very patients that would have potentially benefited, such as this patient, all in the name of supposedly doing evidence-based medicine, looking for what were the best possible uses for a PET. What's another side thing about this particular patient here is that I went in and I met with Ms. Elizabeth Whitmer, the conservative health critic, and I showed this case to her, and I would suggest you watch my video under the stance of the political parties and under the conservative section, and there will be a letter and a video to Ms. Whitmer, because basically what Ms. Whitmer did was she just simply abandoned deliberately the breast cancer patients and other cancer patients in this province, because she just blew me off when I tried to present this to her. Got the standard response, "Oh, David, this is terrible," and so on and so forth. And then when it actually came down to doing something, when she wrote me back, she said, "Well, look, Dave, if there's anything I can do, just let me know." Imagine the Minister of Health critic doesn't know what to do with this kind of information. So here we sit this many years later, and the travesty still exists and is being perpetuated. So, get alarmed, look at the rest of the website, go to the Ombudsman page, find out just exactly what the government is doing to healthcare in this province. And again, PET just isn't the only case that's being, this is just simply an example of what the government is doing. This is not the only thing, PET is not the only thing that they are blatantly moving into the balking mode for your healthcare. So please sign the petition, send this to everybody, send letters to the various people I'm asking you to, and hopefully they won't respond to me, they never have. But maybe if we all get together and we keep pressuring them with emails and phone calls, whatever else it takes, protesting in front of their bloody Queen Park, whatever, stand up and have the politicians explain why they've done this and why this woman was basically this is why the world considers this a wasteland, a third world culture when it comes to access to PET scanning in this country, or in this province. So there's other case scenarios equal, tragic as well. Every one of them is. But do what you can. Please follow me on this one, and we can make some changes with the internet, and hopefully this won't happen again to people like her, because it is as we speak. So thanks, and have a good day.